cardiac amyloidosis or stiff heart syndrome occurs when plaques of protein called amyloid build up in heart muscle, affecting its ability to pump blood, and without treatment can rapidly lead to heart failure and death. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to talk about the benefits of advanced MRI for patients with heart stiffening disease. An advanced form of cardiac MRI developed by academics at UCL in collaboration with the Royal Free Hospital has for the first time enabled clinicians to measure the effectiveness of chemotherapy in patients with a life-limiting condition, stiff heart syndrome. Researchers say that the breakthrough published in the European Heart Journal means doctors will now be able to better guide treatment strategies and by doing so, improve patients' prognosis. Assessing the condition has been difficult as while clinicians can detect the presence of amyloid in the heart, there has been no safe test to measure the amount. This has also meant there has been no way of measuring the therapeutic effect of chemotherapy, the normal first-line treatment. A patient's response is currently assessed with indirect biological markers, but these do not measure the amount or reduction of cardiac amyloid, the drug's ultimate target, and doctors find the markers less useful when trying to assess second-line chemotherapy treatments. Now, for the first time, they have used the technology to evaluate the success of chemotherapy treatment by assessing cardiac amyloid regression or progression. For the study, 176 patients with light chain cardiac amyloidosis had cardiovascular magnetic resonance with extracellular volume mapping. CMR scans with ECV mapping were done at diagnosis and then at 6, 12, and 24 months after starting chemotherapy. The advanced MRI technique allowed researchers to accurately measure the amount of amyloid protein in hearts and for the first time ever to measure the changes in response to chemotherapy on repeat scans. By measuring the changes, they could detect which patients would have a better or worse prognosis. Further, combining the results with blood tests for the disease, it was found almost 40% of patients had a substantial improvement or reduction in amyloid deposition, sometimes that was not thought to be possible before, showing how effective chemotherapy can be. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.